Hello, welcome to today's topic, Biomechanics MCQ for physiotherapists. Let's move to our first question. The plane that divides the body into right and left half is option A frontal, option B sagittal, option C transverse, option D coronal, and the answer is option B sagittal. Moving to our second question. The scapula lies dash degree forward of the frontal plane. Option A 10 to 20 degree, option B 20 to 30 degree, option C 30 to 40 degree, option D 40 to 50 degree. And the answer is option B 20 to 30 degree. Moving to our third question. Knee flexion in prone lying is an example of option A first order lever, option B second order lever, option C third order lever, option D none of the above, and the answer is option C third order lever. Moving to our fourth question. Tightness of the tensor fascial lata causes option A adduction of the hip, option B extension of the hip, option C knocking or genu-valgum of the knee, option D plantar flexion of the ankle, and the answer is option C knocking of the knee or genu-valgum of the knee. Moving to our fifth question. Nodding movement of the head is an example of dash order lever. Option A first order lever, option B second order lever, option C third order lever, option D fourth order lever, and the answer is option A first order lever. Moving to our sixth question. Closed pack position of the MCP joint is metacarpophalangeal joint is option A full extension, option B full abduction, option C full flexion, option D all of the above, and the answer is option C full flexion. Extension allows movement such as abduction or adduction. Moving to our seventh question. During bending forward, the lumbar flexion is followed by option A hip flexion, option B posterior pelvic tilt, option C anterior pelvic tilt, option D pelvic hike, and the answer is option C anterior pelvic tilt. Moving to our eighth question. In high steppage gait, there is a paralysis of option A dorsiflexors of the ankle, option B plantar flexors of the ankle, option C extensors of the knee, option D flexors of the hip, and the answer is option A dorsiflexors of the ankle. Moving to our ninth question. A pathological increase of the neck shaft angle of the femur is called option A Cobb's angle, option B coxa vara, option C coxa valga, option D anteversion, and the answer is option C coxa valga. Moving to our 10th question. In normal standing, the line of gravity passes dash the knee joint. Option A in front of the knee joint, option B behind the knee joint, option C through the knee joint, option D lateral to the knee joint, and the answer is option A in front of the knee joint. Moving to our 11th question. Which assistive device allows for a 2-point, 3-point, and 4-point gait pattern? Option A straight cane, option B walker, option C cord cane, option D axillary crutches, and the answer is option D axillary crutches. Moving to our 12th question. Standing on the toes is an example of dash order lever. Option A first order lever, option B second order lever, option C third order lever, option D fourth order lever, and the answer is option B second order lever. Moving to our 13th question. During flexion of the knee, the tibia glides. Option A medially, option B anteriorly, option C laterally, option D posteriorly, and the answer is option B posteriorly. Moving to our 14th question. Passive or active tension in the triceps surae. Option A, dorsiflexion. Option B, plantar flexion. Option C, inversion. Option D, eversion. And the answer is option A, dorsiflexion. Moving to our 15th question. Shear force is a force applied dash to the contracting system. Option A, perpendicular. Option B, parallel. Option C, oblique. Option D, both A and B. And the answer is option B, parallel. Moving to our 16th question. Anatomical pulleys are option A, increase the magnitude. Option B, change the direction. Option C, decrease the momentum arm. Option D, decrease the magnitude. And the answer is option B, changes the direction. Moving to our 17th question. A hypothetical point at which all the mass would be appear to be concentrated and at which the force of the gravity act is called as option A, LOG, line of gravity. Option B, COG, center of gravity. Option C, BOS, base of support. Option D, ROM, range of motion. And the answer is option B, COG, or center of gravity. Moving to our 18th question. The degree of freedom of the MCPJ of the fingers is, that's metacarpophalangeal joint is option A, 1 degree of freedom. Option B, 2 degree of freedom. Option C, 3 degree of freedom. Option D, 4 degree of freedom. And the answer is option B, 2 degree of freedom. Moving to our 19th question. If length of patella tendon is greater than the length of patella seen in option A, patella baja. Option B, patella alta. Option C, patella neutral. Option D, none of the above. And the answer is option B, patella alta. Moving to our 20th question. In genu recurvatum, patella is option A, stable. Option B, unstable. Option C, requiring more compressive force. Option D, both A and B. And the answer is option B, unstable. Moving to our 21st question. During pronation twist, the calcaneum undergoes option A, supination. Option B, pronation. Option C, abduction. Option D, adduction. And the answer is option A, supination. Moving to our 22nd question. The type of joint is the fifth metacarpal joint. Which type of joint is carpometacarpal joint? That's the question. Option A, pivot joint. Option B, plane joint. Option C, ball and socket joint. Option D, saddle joint. And the answer is option D, saddle joint. Moving to our 23rd question. Which of the following is mechanically inefficient lever system? Option A, first order lever. Option B, second order lever. Option C, third order lever. Option D, first and second order lever. And the answer is option C, third order lever. Moving to our 24th question. Tuber joint angle is important in which of the following fracture? Option A, femoral neck. Option B, trochanter. Option C, calcaneum. Option D, navicular. And the answer is option C, calcaneum. Moving to our 25th question. A therapist places a patient's knee in the resting position. This position is best described as option A, 5 degree flexion. Option B, 15 degree flexion. Option C, 25 degree flexion. Option D, complete extension. And the answer is option C, 25 degree flexion. What is the measure structure responsible for close back position of the hip joint? Option A, muscles. Option B, articular surfaces. Option C, ligaments. Option D, combination of all three. And the answer is option C, ligaments. Moving to our 27th question, the ratio of disc thickness and the vertebral body weight is maximum in which spine? Option A, lumbar. Option B, thoracic. Option C, sacral. Option D, cervical. And the answer is option D, cervical. Moving to our 28th question, hyaline cartilages are found in option A, IVD, intervertebral disc. Option B, ears. Option C, epiglottis. Option D, joints. And the answer is option D, joints. Moving to our 29th question, instability occurs at which degree sprain? Option A, first degree sprain. Option B, second degree sprain. Option C, third degree sprain. Option D, second and the third degree sprain. And the answer is option C, third degree sprain. Moving to our 30th question, how many intervertebral discs are there in the human vertebral column? Option A, 20. Option B, 21. Option C, 22. Option D, 23. And the answer is option D, 23. Moving to our 31st question, which of the following are the cartilaginous connective tissue type? Option A, hyaline. Option B, fibrous. Option C, elastic. Option D, all of the above. And the answer is option D, all of the above. Moving to our 32nd question, which contribute for the viscous nature of the synovial fluid? Option A, hydronate component. Option B, lubricant component. Option C, both A and B. Option D, none of the above. And the answer is option A, hydronate component. Moving to our 33rd question, minimal muscle force is required when the joints are in option A, close pack position. Option B, loose pack position. Option C, in between close and the loose pack position. Option D, in extension. And the answer is option A, close pack position. Moving to our 34th question, when a lateral trunk lean is seen during gait with hip joint pain is known as dash gait. Option A, gluteus medius gait. Option B, analgesic gait. Option C, hysteric gait. Option D, painful gait. And the answer is option B, analgesic gait. Moving to our 35th question, stance phase is dash percentage of the gait cycle. Option A, 40%. Option B, 50%. Option C, 60%. Option D, 70%. And the answer is option C, 60%. Moving to 36th question, center of gravity of the adult human in the anatomical position is slightly option E, anterior to S1 vertebra. Option B, posterior to S1 vertebra. Option C, anterior to S2 vertebra. Option D, posterior to S2 vertebra. And the answer is option C, anterior to S2 vertebra. Moving to our 37th question, which class is the lever of power? Option A, first order lever. Option B, second order lever. Option C, third order lever. Option D, second and the third order lever. And the answer is option C, third order lever. Moving to our 38th question, zone of weakness in femur is that option A, where the system trabecle is relatively thin. Option B, blood supply is less. Option C, muscle coverage is less. Option D, ligaments are slack. And the answer is option A, where the system trabecle is relatively thin. Moving to our 39th question, metacarpopharyngeal joint of the finger has dash degree of freedom. Option A, 1 degree of freedom. Option B, 2 degree of freedom. Option C, 3 degree of freedom. Option D, more than 3. And the answer is option B, 2 degree of freedom. Moving to our 40th question, what is elasticity? Option A, stress is directly proportional to strain. Option B, stress is inversely proportional to strain. Option C, stress is greater than strain. Option D, stress is lesser than strain. And the answer is option A, stress is directly proportional to strain. Moving to our 41st question, how many layers are there in a joint capsule? Option A, single layer. Option B, double layer. Option C, 3 layer. Option D, none of the above. And the answer is option B, double layer. Moving to our 42nd question, what is the commonest ligament injury in the ankle? Option A, calcaneofibular. Option B, anterior talofibular. Option C, posterior talofibular. Option D, lateral collateral ligament. And the answer is option B, anterior talofibular. Moving to our 43rd question, the role of gastrocnemius at the knee joint is option A, static stabilizer. Option B, mobilizer of the flexion. Option C, dynamic stabilizer. Option D, synergetic for knee flexion. And the answer is option C, dynamic stabilizer. Moving to our 44th question, the strongest ligament in the hip is option A, iliofemoral. Option B, ischiofemoral. Option C, pubiofemoral. Option D, ligamento-territorius. And the answer is option A, iliofemoral. Moving to our 45th question, which is not an anatomical pulley? Option A, flexor digitorum profundus contraction. Option B, quadriceps contraction. Option C, hamstring contraction. Option D, peroneal contraction. And the answer is option C, hamstring contraction. Moving to our 46th question, the trabecular system is weak in the spine. Option A, anteriorly. Option B, posteriorly. Option C, laterally. Option D, in the middle. And the answer is option A, anteriorly. Moving to our 47th question, a pathological increase of the neck shaft angle is option A, coxa vara. Option B, coxa valga. Option C, femoral anteversion. Option D, femoral retroversion. And the answer is option B, coxa valga. Moving to our 48th question, which is the key force coupled in the scapular motion? Option A, trapezius deltoid. Option B, deltoid serratus anterior. Option C, trapezius and serratus anterior. Option D, deltoid and rotator cuff. And the answer is option C, trapezius and serratus anterior. Moving to our 49th question, quadriceps femoris shows peak force at option A, outer range. Option B, inner range. Option C, mid range. Option D, throughout the range muscle force is same. And the answer is option C, mid range. Moving to our 50th question, the density of bone is option A, percentage of mineralized tissue. Option B, percentage of non-mineralized tissue. Option C, mineralized tissue or total bone tissue volume. Option D, non-mineralized tissue or total bone tissue volume. And the answer is option C, mineralized tissue or total bone tissue volume. Normally, in standing position, the center of gravity lies option A, 5 cm anterior to second sacral vertebra. Option B, 5 cm posterior to second sacral vertebra. Option C, around umbilicus. Option D, 5 cm anterior to second lumbar vertebra. And the answer is option A, 5 cm anterior to second sacral vertebra. Moving to our 52nd question, third class liver system have always insufficient for which one of the following reasons? Option A, the effort arm is longer than the load arm. Option B, the effort force required is less than the load force. Option C, the fulcrum lies between the effort and the load. Option D, the load arm is longer than the effort arm. And the answer is Option D, the load arm is longer than the effort arm. Moving to our 53rd question, the distal tibiofibular joint is a Option A, synosmosis. Option B, synarthrosis. Option C, synchondrosis. Option D, none of the above. And the answer is Option A, synosmosis. Moving to our 54th question, the function of the meniscus is Option A, shock absorber. Option B, lubrication nutrition. Option C, load distribution. Option D, all of the above. And the answer is Option D, all of the above. Moving to our 55th question, patellofemoral joint is Option A, hinge joint. Option B, a least congruent joint. Option C, more congruent joint. Option D, none of the above. And the answer is Option B, a least congruent joint. Moving to our 56th question, what gives the relationship between the effort arm to the resistance arm? Option A, mechanical advantage. Option B, torque. Option C, both A and B. Option D, none of the above. And the answer is Option A, mechanical advantage. Moving to our 57th question, biceps brachii as an elbow flexor is most effective at dash elbow flexion range. Option A, 45 degree. Option B, 60 degree. Option C, 90 degree. Option D, 120 degree. And the answer is Option C, 90 degree. Moving to our 58th question, shear stress is more in Option A, coxa vara. Option B, coxa valga. Option C, femoral anteversion. Option D, femoral retroversion. And the answer is Option A, coxa vara. Moving to our 59th question, the axis of rotation lies in dash during the locking of the knee. Option A, medial condyle. Option B, intercondylar region. Option C, lateral condyle. Option D, none of the above. And the answer is Option C, lateral condyle. Moving to our 60th question, second class lever will always have a lever arm. Option A, equal to 1. Option B, more than 1. Option C, less than 1. Option D, more than 2. And the answer is Option B, more than 1. Moving to our 61st question, center of pressure means Option A, center of gravity of the foot. Option B, center of gravity of the body. Option C, point of application of the resultant ground reaction force. Option D, none of the above. And the answer is Option C, point of application of the resultant ground reaction force. Moving to our 62nd question, which muscle around the hip is analogous to deltoid? Option A, gluteus maximus. Option B, gluteus minimus. Option C, gluteus medius. Option D, iliopsoas. And the answer is Option C, gluteus medius. Moving to our 63rd question, compressive force in normal walking on the knee joint is Option A, 2 to 3 times body weight. Option B, same as the body weight. Option C, 4 to 5 times the body weight. Option D, none of the above. And the answer is Option A, 2 to 3 times the body weight. Moving to our 64th question, delayed onset of muscle soreness is more severe at Option A, 5 to 10 hours. Option B, 10 to 30 hours. Option C, 30 to 45 hours. Option D, 45 to 60 hours. And the answer is Option D 45 to 60 hours. Moving to our 65th question. Which knee joint ligament helps in locking? Option A ACL, anterior cruciate ligament. Option B PCL, posterior cruciate ligament. Option C LCL, lateral collateral ligament. Option D posterior capsule. And the answer is option B PCL. Moving to our 66th question. Which one of the muscle is not included in the pes anserus? Option A gracilis, option B semimembranosus, option C semitendinosus, option D sartorius, and the answer is option B semimembranosus. Moving to our 67th question. When the spine becomes flat, there is a increased pressure on the option A facets, option B ligaments, option C disc, option D body, and the answer is option C disc. Moving to our 68th question. During complete shoulder abduction, the clavicular movement is option A elevation and anterior rotation, option B elevation and the posterior rotation, option C depression and the posterior rotation, option D depression and the posterior rotation, and the answer is option B elevation and the posterior rotation. Moving to our 69th question. Injury rate is higher in which of the following exercise training? Option A concentric, option B eccentric, option C plyometric, option D in all of the above, and the answer is option C plyometric. Moving to our 70th question. The force frequency relationship between the tonic muscle is option A linear, option B ramp and plateau, option C curve, option D none of the above, and the answer is option B ramp and the plateau. Moving to our 71st question. The ligament subjected to the tensile stress during the backswing or the cook-up position of throwing a ball is option A annular ligament, option B MCL middle collateral ligament, option C lateral collateral ligament or LCL, option D quadrate ligament, and the answer is option B MCL or medial collateral ligament. Moving to our 72nd question. Accessory movement is not option A necessary to completion of the joint range of motion, option B passively occurs, option C under voluntary control, and the answer is option C under voluntary control. Moving to our 73rd question. Which of the following is essential for greater stability? Option A larger BOS, that's base of support, option B closer COG, that's center of gravity, option C LOG outside the BOS, option D both A and B, and the answer is option D both A and B. Moving to our 74th question. The long head of the triceps becomes actively insufficient when the elbow is in extension and shoulder in option A flexion, option B hyperextension, option C maximum flexion, option D abduction, and the answer is option B hyperextension. Moving to our 75th question. What muscle controls with the position of the ankle joint at the heel strike? Option A eccentric contraction of the anterior tibialis, option B eccentric contraction of the gastrocnemius and soleus, option C concentric contraction of the anterior tibialis, option D concentric contraction of the gastrocnemius and soleus, and the answer is option A eccentric contraction of the anterior tibialis. Newton's first law of motion is applicable to which phase of the gait cycle? Option A stance phase, option B swing phase, option C mid stance, option D push off, and the answer is option B swing phase. Moving to our 77th question. For meniscus injury, there should be option A, shear of compressed knee, option B, torsion of the compressed knee, option C, shear and torsion of the knee, option D, torsion of the extended knee, and the answer is option B, torsion of the compressed knee. Moving to our 78th question, inversion eversion component is more in option A, ankle joint, option B, mid-tarsal joint, option C, subtalar joint, option D, none of the above, and the answer is option C, subtalar joint. Moving to our 79th question, larger and possible stronger bone is possible. Option A, excising in adulthood, option B, excising in childhood, option C, excising after growth phase, option D, remaining physically active in the childhood and adulthood, and the answer is option B, excising in childhood. Moving to our 80th question, the coupling movement in thoracic spine is dash. Option A, side flexion and rotation occurs in the same direction. Option B, side flexion and rotation occurs in the opposite direction. Option C, direction depends on the cervical spine flexion or extension position. Option D, side flexion and rotation occurs independently. And the answer is option B, side flexion and rotation occurs in the opposite direction. Moving to our 81st question, the capability of motor unit exercising force is measured from option A, the maximum twitch force, option B, peak force of the fused tetanus, option C, both A and B, option D, fused tetanus, and the answer is option B, peak force of fused tetanus. Moving to our 82nd question, which muscle has the most efficient working capacity among the elbow flexors? Option A, biceps brachii, option B, brachialis, option C, brachioradialis, option D, almost the same work is done by all the muscles, and the answer is option C, brachioradialis. Moving to our 83rd question, a person who is standing on both of their feet is stable when option A, their base of support is as wide as comfortably possible. Option B, their center of gravity is above their base of support. Option C, their center of gravity is close to their base of support. Option D, the position of their center of gravity and base of support coincide. And the answer is option A, their base of support is wide as is comfortably possible. Moving to our 84th question, the ligament that extends from the inferior edge of the ulnar radial notch to insert into the neck of radius is option A, annular ligament, option B, quadrate ligament, option C, oblique cord, option D, none of the above, and the answer is option B, quadrate ligament. Moving to our 85th question, joint reaction force is option A, compressive force in the joint, option B, compressive force and muscle compressive force, option C, compressive force and muscle rotatory force, option D, compressive force of the muscle and other soft tissues, and the answer is option B, compressive force and the muscle compressive force. Moving to our 86th question, at slow speed injury, the failure of ligament results in option A, ligament disruption, option B, avulsion, option C, complete tear, option D, mild tear, and the answer is option B, avulsion. Moving to our 87th question, the hip joint concurrence is best in option A, flexion, adduction and internal rotation, option B, flexion, abduction and external rotation, option C, extension, abduction and external rotation, option D, extension, adduction and internal rotation, and the answer is option B, flexion, abduction and external rotation. Moving to our 88th question, the structure that contribute to the abnormal lateral force of the patella. Option A, TFL, tensor fascial lata. Option B, IT band. Option C, LCL, that's lateral collateral ligament. Option D, none of the above. And the answer is option B, IT band. Moving to our 89th question. In flexed knee rotation in either direction stretches which stretcher? Option A, ACL and PCL, that's anterior cruciate ligament and posterior cruciate ligament. Option B, ACL. Option C, medial collateral ligament, that's MCL. Option D, LCL, that's lateral collateral ligament. And the answer is ACL and PCL. Moving to our 90th question. Tendons fail at an option A, 50% increase in the length. Option B, 8% increase in the length. Option C, 12% increase in the length. Option D, 4% increase in the length. And the answer is option B, 8% increase in the length. Moving to our 91st question. The radial ulnar joint is a diarthroidal uniaxial joint of variety. Option A, saddle. Option B, plane. Option C, pivot. Option D, condyloid. And the answer is option C, pivot. Moving to our 92nd question. The carpal arch is supported by a ligament known as option A, carpal ligament. Option B, flexor retinaculum. Option C, transverse ligament. Option D, none of the above. And the answer is option B, flexor retinaculum. Moving to our 93rd question. Static stabilization of the glenohumeral articular surface is provided by option A, coracohumeral ligament. Option B, coracoclavicular ligament. Option B, superior joint capsule. Option D, glenoid labrum and capsuloligamentous components. And the answer is option D, glenoid labrum and capsuloligamentous components. Moving to our 94th question. Extensor retinaculum in the knee joint. Option A part of capsule. Option B, a part of extensor mechanism. Option C, a part of quadriceps tendon. Option D, none. And the answer is option C, a part of quadriceps tendon. Moving to our 95th question. The most energy efficient gait is option A, walking on usual walking habit. Option B, walking with a slower speed. Option C, walk with brisk walk. Option D, none of the above. And the answer is option C, with brisk walk. Moving to our 96th question. Muscle is most efficient in dash range. Option A, outer range. Option B, outer part of the middle. Option C, inner. Option D, inner part of the middle. And the answer is option B, outer part of the middle. Moving to our 97th question. Pronation twist the calcaneum undergoes. Option A, supination. Option B, pronation. Option C, abduction. Option D, adduction. And the answer is option A, supination. Moving to our 98th question. The sequence of motor unit recruitment is predetermined at option A, brain system level. Option B, basal ganglia level. Option C, cerebellar level. Option D, spinal level. And the answer is option D, spinal level. Moving to our 99th question. The concave convex rule depicts if the bone with convex joint surface moves on the bone with concavity. The convex surface, option A, move in the opposite direction to the bone segment. Option B, moves in the same direction to the bone segment. Option C, halfway in opposite direction and another halfway in the same direction to the bone segment. Option D, none. And the answer is option A, moves in the opposite direction to the bone segment. Moving to our 100th question. For runners, a reduction of impact peak load can be achieved by Option A, forfeit striking. Option B, using the suitable running shoe. Option C, reducing the weight. Option D, all of the above. And the answer is option D, all of the above. So that's all for today. If you need clarification for any of the question, do comment in the comment box. So this is the end of this series. I'll be back with a new topic soon. So do subscribe to this channel. Thank you.